Is California able to test for COVID-19? 21 public health labs in California are testing for COVID-19. These labs include the California Department of Public Health's laboratory in Richmond, Alameda, Contra Costa, Humboldt, Los Angeles, Monterey, Napa Solano Yolo Marin, located in Solano, Orange, Riverside, Sacramento, San Bernardino, San Diego, San Francisco, San Joaquin, San Luis Obispo, San Mateo, Santa Clara, Shasta, Sonoma, Tulare and Ventura County Public Health Laboratories. The Richmond laboratory will provide diagnostic testing within a 48-hour turnaround time. More public health labs will soon be able to test for COVID-19. This means California public health officials will get test results sooner, so that patients will get the best care. Should public events be cancelled? The California Department of Public Health has determined that gatherings should be postponed or cancelled across the state until at least the end of March. Non-essential gatherings must be limited to no more than 250 people, while smaller events can proceed only if the organizers can implement social distancing of 6 feet per person. Gatherings of individuals who are at higher risk for severe illness from COVID-19 should be limited to no more than 10 people, while also following social distancing guidelines. The updated PDF guidance is available. Is it safe to go to restaurants and bars? California public health officials have directed bars, nightclubs, breweries and wine tasting rooms to close. Restaurants should focus on food delivery and takeout while maximizing social distancing for those who are inside their restaurant. Food, beverage and other services guidance PDF. What is social distancing? Social distancing is a practice recommended by public health officials to stop or slow down the spread of contagious diseases. It requires the creation of physical space between individuals who may spread certain infectious diseases. The key is to minimize the number of gatherings as much as possible and to achieve space between individuals when events or activities cannot be modified, postponed, or cancelled. Although the Department of Public Health expects most events with more than 250 attendees to be postponed or cancelled, we emphasize that the venue space does matter. Achieving space between individuals of approximately 6 feet is advisable. Additionally, there is a particular focus on creating space between individuals who have come together on a one-time or rare basis and who have very different travel patterns, such as those coming from multiple countries, states or counties. Should I wear a mask? The California Department of Public Health, along with the CDC, does not recommend that healthy people wear masks at this time. However, masks are recommended to limit the spread of disease for people who are exhibiting respiratory symptoms. What if I have symptoms? Patient: if a person develops symptoms of COVID-19 including fever, cough or shortness of breath, and has reason to believe they may have been exposed, they should call their health care provider before seeking care. Contacting them in advance will make sure that people can get the care they need without putting others at risk. Please be sure to tell your health care provider about your travel history. You can also take the following precautionary measures: avoid contact with sick individuals, wash hands often with soap and warm water for at least 20 seconds. Health care provider: patients who may have infection with this novel coronavirus should wear a surgical mask and be placed in an airborne infection isolation room. If an airborne infection isolation room is not available, the patient should be placed in a private room with the door closed. Healthcare providers should use standard, contact and airborne precautions and use eye protection. Please see Update and Interim Guidance on Outbreak of 2019 Novel Coronavirus 2019 nCoV in Wuhan, China for more information about infection control. The Public Health Department will issue all facility letters to regulated healthcare facilities within California with updated information and guidance. These can be found on the AFL webpage. What should I do if I am unable to work after being exposed to COVID-19? Individuals who are unable to work due to having or being exposed to COVID-19 certified by a medical professional can file a disability insurance (DI) claim. Disability insurance provides short-term benefit payments to eligible workers who have full or partial loss of wages due to a non-work-related illness, injury, or pregnancy. Benefit amounts are approximately 60 to 70% of wages, depending on income, and range from $50 to $1,300 a week. Californians who are unable to work because they are caring for an ill or quarantined family member with COVID-19 certified by a medical professional can file a Paid Family Leave (PFL) claim. Paid family leave provides up to 6 weeks of benefit payments to eligible workers who have a full or partial loss of wages because they need time off work to care for a seriously ill family member or to bond with a new child. Benefit amounts are approximately 60 to 70% of wages, depending on income, and range from $50 to $1,300 a week. For more information related to resources for California's employers and workers, please visit this Labor and Workforce Development Agency webpage. What is the state doing to protect our health? California has been actively and extensively planning with our local public health and health care delivery systems. Here are some of the things we are already doing. As in any public health event, our Medical and Health Coordination Center has been activated and is coordinating response efforts across the state and preparing for possible community transmission. In coordination with the CDC, state and local health departments, we are actively responding to cases of COVID-19. The Public Health Department is supporting hospitals and local public health laboratories in the collection of specimens and testing for COVID-19. California activated the State Operations Center to its highest level to coordinate response efforts across the state. Governor Gavin Newsom requested the legislature make up to $20 million available for state government to respond to the spread of COVID-19. California made available some of its emergency planning reserves of $21 million N95 filtering face masks for use in certain health care settings to ease shortages of personal protective equipment. We are providing information, guidance documents, and technical support to local health departments, healthcare facilities, providers, schools, universities, colleges, elder care and congregate living facilities and childcare facilities across California. California obtained approval to provide meal service during school closures to minimize potential exposure to the coronavirus. These meals are available at no cost to low-income children, and are not required to be served in a group setting, to ensure kids receive nutritious meals while schools are temporarily closed. The state directed mass gatherings be postponed or cancelled to slow the spread of the virus. The Franchise Tax Board is providing a 90-day extension to file California tax returns for taxpayers affected by the COVID-19 pandemic. Caltrans launched a statewide educational campaign on more than 700 electronic highway signs, urging all Californians to be more diligent about containing the spread of the virus. The state is allowing local and state legislative bodies to hold meetings via conference calls while still meeting state transparency requirements. The California Business, Consumer Services and Housing Agency released guidance for homeless assistance providers in the state. The California Department of Public Health is coordinating with federal authorities and local health departments that have implemented screening, monitoring and, in some cases, quarantine of returning travelers. In coordination with state and local health departments, we have actively managed suspect and confirmed cases of COVID-19 patients. California worked in partnership with the federal government to aid in the safe return of 962 Californians from the Grand Princess cruise ship. This mission centered around protecting the health of the passengers, and ensuring that when the passengers disembarked, the public health of the United States, the state of California, and partner communities was protected. 24 million more Californians are now eligible for free medically necessary COVID-19 testing. The state is taking aggressive social distancing steps. Bars, nightclubs, breweries and wine tasting rooms should close and restaurants should focus on food delivery and takeout while maximizing social distancing for those who are inside their restaurant. California is recommending older Californians 65+ socially isolate in their homes. The state is providing safe, wraparound services to vulnerable residents who are isolating at home, ramping up existing meal delivery and home visiting services. The California Employee Development Department (ED) is encouraging individuals who are unable to work due to exposure to COVID-19 to file a disability insurance claim. Californians unable to work because they are caring for an ill or quarantined family member can file a paid family leave claim. The governor removed the waiting period for unemployment and disability insurance for Californians who lose work as a result of the COVID-19 outbreak. ED is also encouraging employers who are experiencing a slowdown in their businesses or services as a result of the coronavirus impact on the economy to apply for an unemployment insurance work-sharing program. The governor declared a state of emergency to make additional resources available, formalize emergency actions already underway across multiple state agencies and departments, and help the state prepare for broader spread of COVID-19. The California Department of Public Health State Laboratory in Richmond and 20 other public health department laboratories now have tests for the virus that causes COVID-19. 20 public health labs in California, including the Department of Public Health State Laboratory in Richmond, are now testing for the virus that causes COVID-19. More information, guidance and information, a complete list of guidance is available. Public, for more information on COVID-19, please visit the Centers for Disease Control and Prevention's website. Media, if you are with a media outlet and have questions for the California Department of Public Health, please email cdphpressopa@cdph.ca.gov. Coronavirus news releases, for the latest information on the 2019 novel coronavirus 2019 nCoV, please see our news releases page. New Guidance documents news releases State health and emergency officials announce latest COVID-19 facts 3/17. State health and emergency officials release guidance to prevent the transmission of COVID-19 in food and beverage venues. State health and emergency officials announce latest COVID-19 facts 3/15. State health and emergency officials announce latest COVID-19 facts 3/14. State health and emergency officials release guidance to prevent the transmission of COVID-19 in gambling venues, theme parks and theaters. SBA to provide small businesses impacted by coronavirus COVID-19 up to $2 million in disaster assistance loans. Resources CDPH. Public health departments in CA. Public health labs testing for COVID-19 PNG. Community transmission by county PDF. FAQ about N95 and protection from COVID-19. Outpatient healthcare facility infection control recommendations for suspect COVID-19 patients PDF. COVID-19 cleaning and waste management for residences PDF. COVID-19 prevention graphics. English PNG. English PDF. Espanol PDF. Coronavirus alert English PDF. Coronavirus Alert Espanol PDF. Coronavirus Alert Chinese Simplified PDF CDC. Public Health Response to COVID-19 Outbreak, February 24, 2020 PDF. Public Health Response and Interim Clinical Guidance for COVID-19 Outbreak, February 2020 PDF. Persons evaluated for COVID-19 January 2020 PDF. Preventing COVID-19 from spreading to others in homes and communities. Guidance for administrators of higher education to plan, prepare and respond to COVID-19. Who COVID-19? Governor's Office. Request for Emergency Legislative Action, March 16, 2020. State Emergency Proclamation PDF, March 4, 2020. Office of Governor Gavin Newsom. Videos Novel Coronavirus 2019 Message from Dr. Sonia Angel, CDPH Director and State Health Officer CDPH's Richmond Lab. Media Message from Dr. Sonia Angel, CDPH Director and State Health Officer 207.20 CDPH's Richmond Lab. Public Message from Dr. Sonia Angel, CDPH Director and State Health Officer 207.20 Page last updated, March 17, 2020. To TOPBACK to top search unclaimed property in California. Save Our Water Energy Upgrade California Amber Alert California California Census California Governor Gavin Newsom Visit Governor's website CDPH Logo Welcome Message P.O. Box 997,377 Mega Siemens 0500 Sacramento, California 95899-7377 For general public information 916-558-1784. Jobs, careers, privacy policy use policy web accessibility certification sitemap feedback useful links state agency directory CA Health and Human Services Centers for Disease Control and Prevention Twitter YouTube Facebook California Department of Public Health 8.1K shares